is a reflection of the health of the human. Okay? And so when we have patients who are dehydrated, they don't eat well, they're super inflamed, different types, right? We have our loose, our dense irregular, and our dense regular. This is going back to first year med school / undergrad here. But it's important as we start to implement therapies for this that we start to understand what we're working with, because different areas can respond differently to different approaches, right? The tendons, ligaments, and meniscus might do a little better with a particular injection therapy compared to the fat pad, which is we've started seeing that clinically, that high concentrations of dextrose in a prolotherapy like in the fat pad doesn't seem to really do that great, whereas high concentrations of dextrose around the tendon and ligament do. Okay? And I think as the field grows, as I start doing more testing and a bit more data collection, I'm hoping that we can also start to figure out, even within PRP, what concentration platelets are going to do better for our dense regular, what concentration platelets are going to do better for our loose connective tissue. So that way, again, we can create more personalized medicine for the patient. So here are kind of all the main cells that are found within connective tissue. What I wanted to stress most here is we focus a lot on the fibroblasts and the chondroblasts, so basically within most tissues and then within the cartilage, where I think a lot of our healing, yes, comes from these cells because these cells secrete collagen, but at the end of the day, if you notice, all of these secrete extracellular matrix, okay? Extracellular matrix is our collection of fibrous proteins. That's things like our collagen, elastin, fibronectin, our glycosamine and glycan, so hyaluronic acid or hyaluronan is the one that we mostly know about. And then proteoglycans such as aggrecan, which is really important in cartilage and we'll talk a bit more about later. But this extracellular matrix exists in conjunction within this framework, this structural framework of our tissues, okay? And there is a direct interplay between the cells, between the fibroblast and the extracellular matrix, even with the mesenchymal stem cells that are going to be local in the area. What they're starting to notice with mesenchymal stem cells, especially when they're looking at the tissue engineering side of things, is the tension in the scaffold. So we're thinking of this extracellular matrix as a scaffold, okay? So think of like a 3D kind of jungle gym, right? The tension within the extracellular matrix impacts how that mesenchymal stem cell is going to differentiate. And so if the extracellular matrix is more set up like the extracellular matrix in bone, that appears to help the mesenchymal stem cell become an osteoblast. If it is more set up like cartilage, it is more likely to go and become a chondroblast. And so these differences in the extracellular matrix are extremely important when we are having our patients heal, okay? You're like, great, what do we do with the extracellular matrix? Well, it's all the stuff that we're already doing, one. But two, this is a reflection of the health of the human, okay? And so when we have patients who are dehydrated, they don't eat well, they're super inflamed, the different cytokines that are going to be present in the extracellular matrix can be different. And that can impact how their fibroblast is going to make more collagen in order to have a healing response, whether it's from an injury or it's from our injection.